Okay, Prynawn everybody. Good afternoon. My name is Adele Carhill. I'm currently the Director for Strategic Partnerships working in the National Value in Health Programme, and I'm absolutely delighted to be here today. Thank you for asking me to be part of this fascinating week, supporting the Welsh Value in Health Centre at the Value in Health Week. Many of you will know that I've been an avid, passionate supporter and driver of the value-based healthcare journey across NHS Wales with Dr. Sally Lewis for over the last 5 years. And I feel honestly really proud to see the spread and scale of such fantastic work that's now taking place across Wales. I've got a dual role actually in supporting this movement, providing both the strategic leadership for value-based healthcare at Aneurin Bevan University Health Board, but more importantly, in the context of today, as a director looking at with a specific focus actually on developing strategic partnerships. Next slide, please. Thank you, Laurie. So I've heard throughout the week the importance of accurate, timely data in order to support value, and also the frustrations around accessing the right data at the right time. And also we heard that information is never available, and if it is, it's not granular enough for use. So we've also heard today the work that started within heart failure at Cwm Taf Morgannwg around the creation of an optimum pathway in heart failure, and how Dee, Laurie and Esther Price have been able to hook onto this work to develop strategic partnerships with the Life Sciences Hub, Roche and DigiPharm on an innovative contract management system that leverages value for the patient and the system generally. So this afternoon, I'm going to share with you my personal reflections on what might be perceived as some of the challenges and opportunities in developing strategic partnerships, with a specific focus on designing and implementing value-based agreements. Next. At this point in the Value in Health Week, you'll have already met a number of the key personnel, the movers and shakers in Wales who are driving the value-based healthcare agenda, including Ivan Evans, who started off the week, the Director of Technology, Digital and Transformation at Welsh Government. And then, of course, our infamous Dr. Sally Lewis, who is the Clinical Lead and Director for the Value in Health Programme. And Paul Mears, who is now the Chief Exec Lead for Value, as well as sponsoring the lead for innovation out of Cwm Taf Morgannwg as the host organisation, and then Professor Hamish Lang, who you'll have heard of also this week, around the education opportunities that are available to us. There are many, many more that you'll hear from during the remainder of the week that are helping to move this concept along. And some of those are not presenting as well, including heads of innovation, heads of procurement, and many, many more across NHS Wales. But for the purpose of my talk today, I wanted to highlight a few others that are instrumental when we talk around partnering for value, specifically as we consider new and different ways of letting agreements with medtech companies, pharma industry, and also working more closely with third sector providers to help us close the ever increasing gaps that we're facing when we're trying to deliver health and care across Wales. So firstly, a little bit around Dr. Rodri Griffiths, the Director for Innovation at the Life Sciences Hub, and the key role that they play in this space. We heard earlier from John Morgan around the networks and engagement channels and the special interest group that's been created as a platform for open dialogue around the value-based opportunities that are afforded to us in Wales. We've got Dr. Susan Myers, the Director of Health Technology Wales, evaluating both from an economic and research basis. And then last but by no means least, Jonathan Irvine, who's the Director for NHS Shared Services Procurement, a great opportunity in Wales, a single channel for connecting procurement across the NHS. One service which is managed throughout the NHS Shared Services Partnership. Next, so where do we start? Well, we're all alive to the challenges ahead for the health and care sector, as you'll have heard throughout the course of the week. The way that we need to manage health and care in the future is very different to what we've done in the past. We're faced with an ageing population, obesity in the people that we serve, and many other challenges. But we know that if we truly believe in a value-based approach, designing and implementing this in an integrated system truly can help us. We know that COVID-19 has further exacerbated these challenges, and our challenge on the road to recovery from COVID will be to think differently, find innovative and creative ways to think differently and behave differently in order to sustain the future balancing of demand and capacity with the cost and outcomes. And value-based healthcare, where patient results are measured against the cost of care, is and will need to stay high on the agenda for a long time. What's become equally fashionable is the concept of partnering for value, or next, the many other definitions that are bandied around about this. Things that we call value-based contracting, outcomes-based agreements or payment by results if we're in England. Value-based procurement, we heard Cwmtaf refer lots to that earlier today. Value-based commissioning, value-based reimbursement, and partnerships creating value. But there are a whole host of others out there that are aiming to achieve very similar things. The landscape's confusing. The concept of partnering, in my view, is not clearly understood, and there is a perception that partnering for value has to be one or the other, when in reality this isn't true. Next. It's interesting to note that when procurement many years ago started to work beyond the traditional price to contract based on a holistic approach, so whole life costing, or what we called it at the time was a managed service, there wasn't so much interest in this concept. It wasn't such a sexy buzzword that everybody wanted a piece of, and not everybody jumped onto this bandwagon. But this actually did create value. Both contracting for price or looking at a whole system approach on whole life costing does evidence value. The main difference, I believe, though, that when we now talk about a value-based agreement or outcomes-based agreement, is that these type of arrangements previously didn't focus on the one thing that mattered, and that is the patient. Why do we need to give these things a badge? Value-based procurement doesn't need a badge. It should be self-explanatory. It means we must partner for value, but we do need to be really clear on what benefits will be derived from such arrangements. Benefits for the system, the providers, both public and private, but most importantly, the benefit for the patient. No one size fits all, and we should be guarded around trying to create a model that tries to do this. But we should, however, consider some fundamental basic principles on what should be core to these kinds of arrangements. Improved outcomes, value for money, cost, good quality, and increased flexibility. Next. So what are the key ingredients for a good partnership focusing around delivering value? Encouraged to hear from Rosh earlier that we share the same values and think about these ingredients in the same way. Vision and values. Are we all on the same page? Do we have the same objectives? Will patients be satisfied that they've got good outcomes? Both from a patient perspective and a clinical perspective, there must be benefit to everybody, otherwise this isn't worthwhile. Collaborative leadership, not competitive leadership. How many times have we found in the past that we're up against each other and we're both trying to get something out of it that doesn't really align with the true values of partnership? We need to encourage innovation. Here's another word that means something different to everybody. And in particular, sometimes a challenging space to get into, sets hairs running. What we all determine as innovation is really different and even more confusing for some of our industry partners. The most fundamental principle in my view is around how do we build true relationships and trusts. It's a bit like butter and margarine when you're baking the cake, isn't it? The key ingredients that hold these things together. Without the butter and the margarine and the flour, things just don't stick. And then communication, that's an obvious one, isn't it? But sometimes the most challenging. The most challenging to have a really good open conversation that's meaningful, timely and transparent for all parties involved. And then agility and flexibility. Are we really able to adapt as quickly as each other? We know that sometimes in the public sector things take longer because of the rules that we have to conform to, but we shouldn't be hiding behind those rules and boundaries and not see them as barriers. And we know that sometimes industry partners, third sector providers and other partners are able to respond far quickly than we seem to be in the public sector. So we do have to find ways of being agile and flexible in the way that we work together and make sure that we don't set ourselves in the traditional ways that we're very familiar with. Next, please. So what could a value partnership agreement look like? Well, I think any payment arrangement that clearly identifies a set of outcomes that are mutually recognised, that reflect the patient, the clinical, social and economic benefits expected, and that defines the measurement of specific outcomes in real world populations. How do I compare Blaenau Gwent with Monmouth versus America to Wales? There is no comparison. The importance of real world data is fundamental to the success of this across all of the world. And therefore, these are the things that need to be included in the specification, very clear data sources to be used to make sure that we represent good and or poor outcomes. Next, please. Simple, I hear you say. Maybe not. Moving from value-based purchasing to value-based partnering is a real challenge. If it was easy, it would have already been done. It would be core to the way that we deliver healthcare services today. Next. So the momentum in Wales has been building since 2004 and probably before that. The enthusiasm is great. We've heard it this week, real passionate individuals coming together to share their views and experiences around value-based healthcare. But the commitment is really challenging. Everybody wants to commit to this, but finding the route through it can be a real endeavour. There have been some great examples of partnering in this way and some fantastic examples shown so far this week with more to follow. There's work that's been showcased at an international level previously around gene therapy and robotics in Cardiff and Vale Health Board, heart failure as demonstrated earlier by Cwmtaf Morgannwg, and later today you'll hear some fantastic work that's been done by the Lymphedema Clinical Network Wales team on how they've been able to change the way the quality of life for the patients with lymphedema and cellulitis across Wales by redesigning their models of care. Next slide. What's important to understand when we talk about this value approach, and particularly when we try to put a commercial spin on this, we're not talking about your traditional commodities or widgets. We're talking about people, talking about healthcare, and it isn't as straightforward. Stakeholders must have a unique value equation, so it has to be equal for all partners and therefore understood by all partners. It should be simple. We try and sometimes overcomplicate things because we think we should. This needs to be simple and understood by everybody. And most importantly, it must be linked. The value equation must be linked to the wicked issue that we're trying to solve together. And we all must be held accountable for making it happen and happen well. Next. So some of the challenges, we heard earlier really, Dee put a challenge out to her panel around some of the things that they have found a struggle in trying to devise the value-based procurement agreement at Cwmtaf Morgannwg in heart failure. And I was pleased to hear that some of these were common to my personal views as well. The one they talked about was this common language, and those of you that have been around the value-based healthcare agenda for some time will know, as Dr. Sally Lewis repeatedly tells us, there are so many connotations around this narrative, and you know, we do need to try and strip it back and make it simple for everybody to understand. Some of the challenges around resource and expertise. Do we have the right expertise when we're entering into this dialogue with partners, so you know, with third sector providers, industry partners, medtech, pharma, procurement, health economists? Do we have the right expertise in Wales to be able to do this? Aligning the right people with the same passion and desire to improve the way that we deliver health and care to the population that we serve. How many times I'm thinking back my own career, with 30 plus years as a procurement professional, how many times prior to hearing about value-based healthcare did I go into those conversations with the patient truly at the heart of this? How many times did I go in thinking what I was buying, whether it be a product, a solution or a service, the impact that might have on the patient? I'm not embarrassed to admit that at that time I didn't think of those things, and his personal experience has allowed me to really reshape my thinking, and to think about how I can influence the shape of strategic partnerships going forward in Wales to make sure that we do put that patient at the centre of everything that we do. And then data, like I said at the start, we've heard lots throughout the week around some of the challenges in accessing good validated data and establishing the single source of the truth. Again, I think we are some way off this, but we do know that the work around the national data resource will eventually help us to support providing this data in the most meaningful and truthful way. And then time, given where our clinical and other healthcare professional teams are trying to recover from the pandemic, how are we able to release the right multi-professional teams with the enthusiasm to innovate versus balancing this urgent care planning? More challenging than ever now, but we do have to think about how we create the headspace. And is this the opportunity to work with our partners to support us? We're ideally positioned really with the existing integrated healthcare system that we have in Wales, but I'm not convinced that we maximise the opportunities afforded to us with this system. And then finance, how do we balance the money? How do we, and I'd be interested around some dialogue maybe later around, how do we balance funding within the 12-month period and accruing that money into multiple years where we're trying to get true partnerships where we're not committing all of the funding up front, and we need to think about how we get recompensated perhaps between years. I think that may be a little bit of a wicked issue that we may need to think about as a team collectively. And then access to Wales, the landscape is really, really confusing. Again, having had vast experience around procurement and working with strategic industry partners over the years, I couldn't clearly articulate how somebody enters Wales. There are so many players on the field, and we need to make sure that we understand the role of every one of those players. Next. But we do have some fantastic opportunities. COVID is an opportunity for us. If we use it rightly, we've proven how quick we can respond when we are on that burning platform. We've shown we can work together collaboratively when we've got a common goal. Let's take that learning and extend it into other areas. Some of the financial incentives use the fact that we've got policy and strategic buy-in from Welsh Government to support new and different ways of working and supporting innovation. We heard the Health Minister talk at the opening of the Value in Health Week, and also in her statement released in July of this year, where she's fully supportive around innovation and funding innovative ideas. And let's use the opportunity of the new way of working through agile and virtual and working from home, that we've got buildings and space. How do we maximise the use of those empty buildings and space? And how do we invite industry and other partners into those spaces to deliver the health and care services that the population need moving forward? Next. So what are some of the benefits from this approach, the way that we could potentially work differently and partner for value? The benefits to the patient and clinical teams providers are satisfied with the treatment that they receive. We've all talked throughout the week, and it'll be a continuing theme as we progress through this, around how do we evidence improved outcomes. We have to be able to do this. The measurement and use of the data is fundamental for us to evidence this as a benefit by improving those outcomes and reducing cost. Let's get open and transparent with each other. Let's sit around the room together as a multidisciplinary team, drop our badges, think about our names and what we're there to do, and think about how we're going to reduce that cost collectively for the benefit of all. And then encourage innovation from our partners, and I mean ourselves, our colleagues, our clinical teams, the innovation that they come forward with, that they might think is the daft question or the daft solution, and when we know actually the people on the ground are the ones that really have the right ideas. They see how we can improve on a daily basis. Stronger alignment of our goals and partnerships. We know that the planning framework in Wales, which would be launched soon, will have a real heavy emphasis around value-based healthcare and the way that we partner for value. That gives us another step up in terms of the permission across Wales to work in this way. And then more flexibility for the providers to do what's best for that situation, and greater efficiencies from everybody from start to finish. Next. So what are the next steps for us in Wales? As I said at the beginning, I've been asked by Dr. Sally Lewis to support the National Welsh Value and Health Centre, and in particular with a focus around developing strategic partnerships. So we're looking to develop a community with a common aim and objectives for Wales, bringing in everybody that's interested on that playing field, but to make sure that we're all trying to score goals in the same direction. The people like Life Sciences Hub, Health Technology Wales, third-party providers, industry players, but making sure that when we are sitting around that table, having that true partnership and collaboration, we're working on the right things, the things that really matter and can have a dramatic impact on the population across Wales. And we're looking before Christmas to set up this community of all of those individuals to make sure that we can develop a very clear plan that we can share with our partners around how you can work with us in the future. And we're also going to think about how we can share data, that trust word coming up again, how we can share data in a meaningful way that creates that trust that allows us to be able to measure jointly in order to evidence this value and gain clarity, as I said, on the important and urgent thing, the wicked problems that we face in Wales, and making sure that we're sharing those problems and challenges with our partners. And more importantly, creating the safe spaces to do this work, to make sure that people say, feel space. We've got a project ongoing at the moment working with Swansea University Intensive Learning Academy, which Hamish has shared a little bit around how do we look retrospectively. It's called the Ideate programme, where we're looking retrospectively at working with an industry partner on a product that's already in use and contracted for within Wales, to think about how we develop an outcomes-based agreement and what kinds of things we would measure to evidence value. So let's do this in a safe space. Let's start small and do it well. Next. So that's all from me. I hope that's given you something to think about, but also to give you some reassurance that we are serious about this in Wales. We do want to develop these strategic partnerships, and I think with the support that we have from Ivan Evans and the team, the Minister in Welsh Government, the fact that this is seen as a strategic importance within the Value in Health programme through Dr. Sally Lewis, and the fact that they have asked me to direct this with some full-time dedicated resources to support it, suggests that we are very serious about this, and I look forward to any questions. So thank you.
Thank you, Adele. Great insight into value-based agreements. Clearly, there's a lot to consider in building strategic partnerships. We need to think and behave differently, but also to be clear on what we mean by partnering for value. Clearly, a number of challenges as well. So in terms of question and answer or questions being raised, open question for yourself. It can be difficult, confusing for industry to know how to engage with NHS Wales. What do you see as the best entry point for industry interested in collaborating with value-based healthcare in Wales? Sorry, Adele, you're on mute.
That's an old trick now, isn't it, that we should have all got out of, but yeah, apologies for that. So yeah, that's a fantastic question actually, Saeed, and actually that was on my last slide around next steps in terms of trying to build this community. One of the things that I've been set as an objective before the end of the financial year is to try and design in partnership what that roadmap looks like for industry partners, and particularly what is the entry route. Now, they're currently the entry route, which I think has been a fantastic place for industry partners, has been through the Life Sciences Hub, and they've been fantastic at signposting out to the other connections across NHS Wales, and that potentially will still play a big part as we move forward. But I think where we'll be clear is whether you're coming to the table with a new product that needs to be designed, a product that's already mature, and how do you actually get into Wales with in designing a contract, but also around how do you enter Wales when you've got ideas that products don't exist for. So things like solutions, when I talk about the gap and the empty buildings in Wales, how do you come to partner based on multiple products and multiple solutions? So we will be designing a framework, as I said, and a journey map that we will be sharing out widely before the end of this financial year. It is a confusing landscape.
That's great, thank you, Adele. Next question. Are there any plans for a sandbox that industry can use to test innovation using NHS Wales data and digital systems in a safe environment?
Yes, a really good point, actually. I am aware that there have been many sandboxes established previously, particularly around the innovation space. And particularly with the work that Life Sciences have done with digital health, so DHCW, or the old NWIS, as people might be more familiar. I'm not aware, unless somebody corrects me, that we have ever created sandboxes around outcomes-based agreements or opportunities to link value with industry partners. And that has just given me a fantastic idea around what our new community might consider as we move into next financial year. So unless somebody tells me any different, which would be great because I can learn from that, there's definitely something I can consider moving forward.
That's great. There's a number of further questions cropping up. When can we expect to see the roadmap you describe?
Yeah, so the plan is that it'll be launched by April of next year. We'd like to do it sooner, but by the time we finish our recruitment and we bring the community together, it's more likely to be in March and then launched next April.
Okay, that's great. So I'm trying to keep on track of all the questions. A general question here, is the culture of the NHS a challenge in delivering partnership with industry?
I don't think you can, my personal reflection would be, I don't think you can generalise that it's the culture of the NHS. I think there are pockets of good, bad and indifferent culture, as we all know, across the NHS. I think there are traditional ways of working and the ability to accept risk and manage risk will be different. And I think partly that will be down to the experiences of those individual organisations and whether or not they have had a bad experience or a bad taste left in their mouth working with industry or other partners previously. My personal experience has been very, very positive, and I think if you put the right people in the room who have the same values and passion and desire to improve things collectively, then the hurdle should be far less. I think it's when you bring together individuals who don't have the same goals and have different motives behind why they're trying to form that partnership, then it's time to say goodbye to each other.
Okay, that's great. Thank you, Adele. Moving on to the next question. Do you envisage legal services forming part of this community to provide some assurance around this new method of contracting?
I absolutely do. What I would ask of legal services is that they, like ourselves and like procurement colleagues, can help us to work within the legislation, but remain open to find agile and flexible ways of working within those boundaries so that we really can create this safe space for innovation and opportunities for us to try things, not necessarily pilot, because we pilot to death in Wales, but to try things within the boundaries that we must comply with.
Thank you, Adele. Linked to that question in some respects, is any scope for non-NHS Wales partners?
Absolutely, absolutely. I think, you know, it can't be NHS for us. If we think about some of the problems that we face solely in the NHS, they are inextricably linked to public health, to social and health, you know, social services, social care, and I genuinely don't think that we can't do any of this without partnerships with social care. And we do have some great opportunities through the regional partnership boards and more latterly the RIC hubs that have been established in Wales to create that space for innovation across health and social care. But yeah, we can't do this on our own. It has to be wider than the NHS.
Okay, that's great. Next question.
I feel like I'm on question time, actually.
Sorry.
This is fab, yeah. I didn't have a specialist subject.
Should score you, yes. Pass or fail. Sorry. So the next question. One of the challenges you mentioned is partnering is access to resources, finance, and the right expertise. How are these challenges being addressed?
So I can speak on behalf of finance and procurement, who are fundamental in this multidisciplinary team. So I know that through Jonathan Irvine, who I referenced earlier, and Claire Salisbury, they have been developing or designing a new national operating model, which absolutely has value-based principles at the heart of what it's attempting to do. So I'm not quite sure when, but I know that they are going to be launching this new operating model very soon, and that during that they will have been providing training, education and expertise for the staff that they work with. And then similarly, the finance fraternity have a fantastic leadership programme anyway, under finance leadership and development. But I'm also aware that many of the finance team have been through the Swansea University Intensive Learning Academy and are also developing their own value-based finance programme, a 2-day programme that they will be expecting senior strategic finance influencers to attend. So some great movement there in terms of finance and procurement. And similarly, clinical teams I know are participating in the executive education programme and other things that are being provided across Wales. So I guess in time we will have expertise throughout the whole of Wales.
That's great. Thanks, Adele. No time to rest. A few more questions. Very interested in considering the value-based concepts spoken about and how they translate to underpinning partnerships, contracts, service agreements, reporting mechanisms, etc., used for digital and IT services. How should I link in with the community to see what contribution we can bring, please?
So I think as of today, there's probably a couple of routes. As I said earlier, the Life Sciences Hub is a fantastic place to enter, and they will signpost you out appropriately to the right places. There's also something around talking to DHCW in particular, because they have a very clear digital strategy for Wales and therefore would be able to understand how providers might be able to help them in their journey. But as you would expect, I would also suggest that you talk to procurement around opportunities, because they are, they have representation not only at the national team but within each of the health boards, and would be acutely aware of some of the challenges that are being faced both locally and nationally.
Okay, that's great. So next question, I'll just read it out. I didn't realise some of these were quite long questions, but this one's quite short. So great presentation. Does Adele see working with the pharmaceutical industry and the co-production of the roadmap are fundamental to its success?
Absolutely, absolutely. I mean, when I talk about this, I don't really want to call it an MDT, but multidisciplinary, it is a multidisciplinary team, professionals that has to include pharma, medtech, third sector. What I'm hoping to do is to create a first draft internally, I mean internally to NHS Wales, and then when we have something that is a really good straw man, that we can take that out then to pharma, medtech and third sector providers to work with us to cement it really, so that we come up with something that's in collaboration, as I say, not in competition or even really opposed in opposition to each other. So yeah, absolutely.
Great. So link back to a previous response. Thank you for clarifying that a roadmap and entry route is being worked on for industry partners. Is there a platform we can keep an eye on with this update?
Yeah, great again. So again, I feel like I'm a plug. I feel like I'm working for Life Sciences Hub today, actually. But this is the fact and how they have been supporting, particularly the Value in Health agenda. But Life Sciences Hub have created a special interest group, which I know has many, many partners on it. And at the moment, I'm sharing updates there. But again, I would challenge attendees today to work with me to think about the best place that I can do this. Obviously, we will be promoting it through the Value in Health website. So if you've got access to that, or if you haven't, I mean, you'll get it through attending this week anyway. But if you also think that there's other forums that it would be worthwhile me considering, then I'm more than happy to consider those.
That's great, thank you. Next question. How are you going to decide who will be around the table of the community, of the Wales community?
Yeah, so I think first of all, I won't be deciding. I think, as I said earlier, in terms of the players currently, there are many of us already on the pitch. Some of us which I think are adding value, and maybe others that are not. So the first thing we're going to do is take a look at who is playing in this field and make sure whether we've got some fantastic strikers. Yeah. Once I understand that for Wales, then I think the next challenge will be understanding that the wicked problems that we're trying to solve. Yeah. And then reaching out probably through a formal and probably a bit more of a formal mechanism to industry and other partners around how they might want to come to that round table to work with us on this wicked problem. I don't individually have the expertise to say X, Y, or Z. So this is going to be a bit of a call out to industry partners around who we think should be there, and there will have to be some criteria. I think not to prolong the response, but I did a talk not so long back at the special interest group around why I would partner with somebody, and I use the analogy of a job description and go into the market with a very clear job description on trying to recruit somebody, and not, because what I find currently is I have lots of candidates knocking my door, maybe uncertain on what the narrative is, but also just wanting to get into this space And what we need to be a bit smarter on in Wales is going to the market with a very clear job description of how we want the best people to apply for that. And that analogy for me really rang true. I'm thinking about, you know, I could be exhausting time and effort, as can industry partners knocking our doors, when we don't have the headspace or the opportunities to let them in at that time. So we really need to think about the analogy and how we might attract on both sides the right people at the right time for that conversation.
That's great. Thank you. I think we've got one more question. So you talked about the benefits for partnering for value. Are there any plans to determine how you're going to measure those benefits? What's that approach?
Yeah. Again, you know, this comes back to these this age-old challenge around data, doesn't it? And what data? And I think, you know, myself included, when I first started to consider this approach, and I think I mentioned this in the presentation, is not one size will fit all for this, and there will be some data that is already available to us that can evidence a value opportunity. We have huge clinical outcome data available to us that we probably don't use effectively when we look at procuring new products and solutions currently. There's the opportunity where we can have dialogue with partners without a procurement. I mean, you know, what I don't want is for us to get stuck in this box without being able to move outside of it, around it, and the data might have to come afterwards. I wouldn't want us to not engage with partners around ideas and opportunities because we aren't mature enough with some of the data. The maturity of the partnership will allow the data to form part of that as we progress. But data would probably be one of the bigger challenges.
That's great. I think that's it in terms of questions. I can't see any more in the chat, so just like to say thank you, Adele, for presenting the session and for answering all the questions. Unless there's anything else, this brings the session to a close. Thank you all for listening and joining this session.
Thank you.